Today's lecture is on immune system disorders. So one of the immunodeficiencies out there, which is acquired, is HIV. And it infects helper T cells, and as a result, the number of those cells go down. Eventually, if the patient gets a very low T cell count, they develop what's known as AIDS, or acquired immunodeficiency syndrome. Other examples would be T-cell types of lymphomas. Epstein-Barr viruses can cause immunodeficiencies, and even measles can do that as well. Now, our immune system deficiencies can lead to cancers, and it's a very difficult thing because if your immune system gets affected, then cancer cells can grow uncontrollably and cause several different types of problems, as you are probably well aware. Now, immunotherapies are anti-cancer treatments that are geared to boosting your immune systems. So some things like Gardasil, you may have heard of that, guys. It's something that's been developed. It's a vaccine that prevents HPV infections. And there's also other types of therapies for cancer like monoclonal antibodies, interferon. And there's a lot of new T-cell types of therapies out there that are really promising and helping make your immune system actually fight the cancer that you may have. Now, autoimmunity is an immune system problem where your own immune system attacks itself. They can be chronic, and we're still not sure why they occur, but it seems like genetics definitely plays a huge role in autoimmune deficiencies. So some signs: joint and muscle pain, fatigue, rash, organ dysfunction, low-grade fevers. And you can also see sometimes, if you think of something like rheumatoid arthritis, you'd see swelling of the joints. They get big, very painful, a lot of inflammation, things like that. Now, diagnosis involves looking for self-reactive immune cells and sometimes autoantibodies as well. So usually it takes more than one type of test to specifically say a patient has an autoimmune disease. Now, hypersensitivities. These are inappropriate immune responses. They could be allergies, they could be autoimmunity. Sometimes they're localized to one spot of the body. Other times they're systemic, which would be throughout your body. So, an allergen, then, is any antigen that will trigger IgE production. And if any of you have allergies, you know how bad that can be. These types of allergies would be considered a type 1 hypersensitivity. Now, with hypersensitivity 1 reactions, all allergies are included. Things like asthma, dermatitis. If you take a look at this person's skin, you can see all of these, what look like little blisters occurring, cracking, things like that. Atopic eczema is a good example of hypersensitivity type 1. What happens with these is that the allergen, the person's exposed to the allergen, and you then trigger your immune system to produce the IgE. So at first, when you come into contact with it, you're okay, but the second time, because your mast cells here have those IgE antibodies on it, your system reacts to that allergen. Now, after you're sensitized, then you get this degranulation, and that's what really starts to cause a lot of problems. So a lot of times people experience more allergies the older they get because they're exposed to allergens throughout their lives. So when we think of anaphylaxis, a lot of times that is systemic, and you can have it on your skin, respiratory system, central nervous system, cardiovascular, and also gastrointestinal systems. So anaphylaxis, you could actually go into shock as a result of that. For type 2, these are often cytotoxic. So for the type 2 hypersensitivities, please know that IgG or IgM will bind to non-soluble antigens. That's an important fact, guys. Non-soluble antigens on the surface of a cell or within the extracellular environment. So complement system can be activated, leukocytes can be recruited, etc. in these types of reactions. Now, we also have what can be called hemolytic transfusion reactions. And again, if you guys think about someone who is type A getting type B blood, your red blood cells could potentially lyse. And there's situations that you can actually kill a patient if they're given the wrong type of blood, wrong type of, let's say, organ, etc. And basically what could happen is kidney failure and ultimately death could result. Now, hemolytic disease of the newborn is a situation where an Rh negative mom who's pregnant with her second or third child, etc., who's Rh positive can really cause problems. So what happens then is the first time the mom is pregnant with an Rh positive baby, she will develop then antibodies against the Rh factor. What happens then in the second child or third, etc., is that the baby's Rh positive red blood cells then can react with those antibodies, eventually causing death or damage to the fetus. So again, first time the mother gets exposed, she's negative, so her body produces antibodies. And then the second time, if those antibodies cross the placenta, they can start to lyse the baby's red blood cells. Please take a screenshot of this and upload it. For type 3 hypersensitivities, this will develop when IgG or IgM antibodies bind to soluble targets. So these bind to soluble targets. So this leads then to excessive antigen-antibody complexes, and those will be deposited then in different tissues. And that triggers a pretty massive amount of inflammation as a result. And for type 3, usually your autoimmune diseases fall within that. Maybe you guys have heard of lupus and rheumatoid arthritis. Those are probably the two most common types people know. So this can be very painful, debilitating as you age, etc. So these are pretty severe types of reactions. The last type, type 4, are not antibody mediated. However, they are T cell mediated. And what happens is that the T cells will respond to self-antigens or otherwise harmless antigens. So these are quite often considered delayed hypersensitivities because it takes anywhere from 12 to 72 hours for the reaction to occur. So a lot of times it's hard to tell what caused it in the first place. Now, a condition called Guillain-Barré syndrome is something that occurs in some individuals as a result of getting an infection. For instance, getting a Campylobacter jejuni infection or Mycoplasma pneumonia, even CMV or Epstein-Barr virus. And what happens is the T cells will attack nerves that regulate muscle contractions. So this is considered a nervous system disorder. Now, non-immune type 4 sensitivities would be things like poison ivy. And if any of you ever had that, what happens is you get exposed to it. The first time, nothing really happens, but then your T cells remember that, and the next time you get exposed, cytokines, which are chemicals that are involved in regulating our immune response, will be released, and then this is what you see. Now, other things we have to be aware of, guys, is that a lot of people out there have to have transplants for some reason or another. And you want to have the best match you possibly can. So please know these different types of grafts. If a person gets an autograft, that is a transplant from yourself. So what that means is that, for instance, let's say you have damage to your skin due to burns or a bad accident or something like that, you could take skin from one part of your body and put it on the other. Now, an isograft would be a tissue or organ transplant from an identical twin. These are pretty safe because identical twins have the same antigens on their cells, so it's the best match aside from, obviously, yourself. Allografts, this is the most common type. You want to get as close a match as you possibly can. These patients have to be on immunosuppressive drugs for the rest of their life. And then the last type, xenograft, this is from a different species. And the best example of that would be we do a lot of heart valves, guys, that are actually from pigs.